this summer in July, there's going to be a 2-day on-farm summit in northern Montana. It's going to be up around Haber, and it's called Intersections of Farming, Climate, and Health. It's going to be actually really pretty fun. There's 25 slots open. There are some slots open for students, so students and also not student people. What this is going to be is there's going to be 2 farm tours. It's going to start out with a farm tour at Bob Quinn's farm, and there'll be a meal there. And the meals at the different places are the foods that they grow and prepared on site and prepared with their local ingredients, rye and the other things that they dryland farm. So this is going to cover like regenerative agriculture, but also so much more, like economic stewardship of the land. The farmers are going to talk about what they do in their fields and how their relationship has grown and how they are stewards and how they feed into it and they get back from it. There's a lot of emphasis on food as medicine that's going to go with this. So it's, healthcare providers and using food as medicine and the intersection with farming and with growing food. The second farm that will be on Saturday will be Villicus Farms. Well, there'll be a breakfast that uses their rye that they grow there. And then there's farm tours where the farmers talk about what is going on there and how they take care of their land and what they grow and why they grow it as such. And it will end with Abundant Montana and their program of 33 by 33. And what that is that the hope is that by 2033, that 33% of the food that is consumed in Montana is grown in Montana. So it's local food. So it's all about supporting the intersections of all these things, the health of the farm, the health of the people, the health of our medicine. So July 11th and 12th, there's some flyers out on the table about it. And because it's only 20 people, if you're interested, go check it out right away. Who do I give this to? I think me.
Hi, good afternoon. Thank you for inviting us here today. My name is Bonnie Buckingham, and I am the co-founder and executive director of Farm Connect Montana. And I don't know how we change the slides. Does anyone know how to do that? No. Maybe I can just, oh, there we are. Okay. Oh, thank you. Perfect. Okay. Farm Connect was started back in 2005, really to provide a space for people to participate in food democracy, really having a role in how food is grown, processed, distributed, and eaten. And our mission is really to grow a local healthy food community by conserving farmland, supporting farmers, and making food accessible for all. We are located at the Lalonde Homestead, which is out by the airport. You probably have noticed it as you drive by on the freeway. And we recently moved in there. It's a partnership with Missoula County. It is a park and also a place where we are developing to learn more about the history and the future of agriculture in our community. We have a lot of different programs that we run. We focus on farmland conservation, helping beginning farmers get started, and providing food access for everyone. There's a lot of numbers up here. For farmers, we have a farmer tool library on site. We have a program that helps farmers learn how to be good business people and connects them to markets. We also have a mentorship program, and we have an online connection service called FarmLink, where people that are landowners can get connected to people that want to farm, and we help create those connections. Probably what you might be most interested in is our food access. We have 3 different programs. We have a double SNAP dollar program at the farmers market in 40 different farmers markets across the state. And we have a senior farmers market nutrition program for seniors. They get a coupon that they can use at individual farmers or farmers markets, and they get $40 worth of produce during the summer. And then we have our produce prescription program, and that is really a study. And there's a lot of information on here. There is a poster out in the lobby if you want more information about this. But we do have 7 clinics across the state. And you can see on the map there how that is. A lot of them are in tribal communities. Over the past 3 years, this is a 5-year program. It's a study for tracking health markers for diabetes and other similar illnesses. And we have had $178,000 and just under 1,000 participants utilizing a prescription of local produce to improve their health. So that's us in a nutshell. We do a lot of different things, but I don't want to take up a whole lot of time because I want to learn more about what Lindsay and Sarah have to say. So I'm going to introduce Lindsay. She received her BA in Nutrition from the College of St. Benedict and MS in Sustainable Food Systems and Dietetic Internship from Montana State University. She directs the Montana Dietetic Internship and Graduate Program's Clinical Supervised Practice. And with student help, she researches weight inclusivity and sustainable and indigenous food systems in dietetics education. Those are a lot of really big words. She lives in Livingston, the unceded lands of the Apsaaluk, with her bird dogs and partner hunting, fly fishing, and mountain biking. And after she presents, Sarah Johnson is going to talk. She's been balancing her careers in farming and nursing for over 15 years. She manages the award-winning environmental stewardship program at Providence St. Patrick Hospital. She owns and operates Tangled Carrot Farm, a small-scale farm in the Bitterroot Valley with her husband that's devoted to building soil health to resilient farm kids and community. She's enjoyed building on-farm resilience through the NRCS Environmental Quality Initiatives program, and she serves on the board of the Missoula Food Bank. She's also obtaining her master's degree in sustainable food systems from Prescott College. So both very busy women, and thank you for coming. And we will have a time for discussion and questions at the end, but I think we'll have both presenters and then we can open it up for discussion. Lindsay? Oh, I'm sorry.
Flexible. Hold on, I have to unlock my phone. I have my, there we go, my notes in case I need them. All right. Thank you for that introduction, Bonnie. I would just like to say my farm would not be in existence without the support of Farm Connect Montana. I've utilized their Beginning Farmer program, their senior coupons. I accept those at my farmer's market. I'm a member of their tool library. They've been a fantastic support of my farm. So I'll talk a bit about farming, and then in the question period, I'll talk about work that I do at Providence St. Patrick Hospital and how these two worlds have sort of converged for me. So this is a very busy slide. I'm not going to spend a lot of time on it, but what I would like you to do is see that when we eat food, and all of us must eat food to survive, that it is an interaction of biological systems, economic systems, political systems, and social systems every time we eat. I forgot to put the reference on here, but if you want to see and spend more time with this, you can look at nourishlife.org and you can see this in further detail. So let's start at the beginning here. The United States government sold more than 90 million acres of indigenous land during the allotment era, and we've heard other people speak to this today, but with that loss of land came a loss of knowledge and a loss of food systems and really living with the land and living off of the land, and a loss of that, or not loss entirely, because we've heard about resilience of our Native peoples, but there has been a change and damage to their food sovereignty. And food sovereignty, if you don't know what that means, it is the ability to provide yourself cultural foods using agricultural methods that that you value, more or less. There's a nicer definition in my notes. We've already seen this slide today. I was happy to see it one time before. But just to remind you that when people were moved off their land, they were moved, and it was already said today, to unproductive land spaces where their relationship with food was really challenged. So over the last 200 years, food systems have changed significantly. We've had a rise of industrialization, and with that, increased mechanization on farms and a reliance on fossil fuel resources. That comes in many ways, not just the farm equipment, but also with inputs on farms, such as pesticides, fertilizers, and herbicides that are derived from fossil fuels. And those fossil fuel-based chemicals have been known to cause harm to human health. The harms include acute exposure, which can impact eyes or respiratory systems, or itching, burning skin for people that are working directly on the farm. Once the food leaves the farm and we consume it, there can be damage to endocrine systems and neurological systems, and I'm forgetting one of the impacts on humans, but there are many, and they also impact the environment as well. I forgot to mention on my slide, if you want to learn more about the slide before, resilient food systems for Native peoples, you can visit Montana State University. They have a website devoted to, let's see, what is it called? Buffalo Nations, that's exactly right, Buffalo Nations. And then firstnations.org also has some really great information on some of the work being done to revitalize Native seed banks and relationships with food. Now, farming has changed significantly, but I think in the United States, when people think of farming, they still think of images like these. And it's the image that is really put out there with marketing of farms, despite farms being very different. And I'll talk about what those farms look like now. I also just wanted to share the picture on the top left is my daughter on my small farm. And the picture on the bottom right here is the farm where I fell in love with farming. That's Killarney Farm in North Idaho. It's about 40 acres that's surrounded by national forest. It's off-grid. It uses hydropower and solar power. And this farm now no longer is insured because it is in the middle of a forest. And it's at risk of burning down with wildfires. So that's a whole other topic. But these are the images that people think of when they think of farming. However, what's happened is that we've had farms are getting larger in scale. Farms are now on the farms that are 2,000 acres or more have grown by 15% since the 1980s. And consolidation and concentration is happening across many aspects of our food system. So on this side here, if you just look at those gray bubbles, there's like 3 to 4 companies that are really dominating the market with processing or distribution. And then on this left side here, this is the organic industry structure. And what I want you to take away, because it's a very busy slide, is that the yellow bubbles own the companies that are in the brown bubbles. And sometimes it's not known that those brown bubbles are owned. There's also consolidation happening with farm inputs like seeds. There's some companies that are really dominating those spaces that are holding onto that seeds and fertilizers and pesticides. And so with that concentration it's concerning to farm workers, to our food security. And so learning how to stop this is important. And it's one of the reasons why I value small farms so much, and why I think Abundant Montana cares about 33 by 2033, because we need to have a local resilient food system. Oh, sorry, do you want me to go back? Did you get it? Okay. My mouth also gets dry when I present, but today I'm not sweating profusely, everyone. So it's really exciting. All right, so this actually, I personally think it still is like a pretty nice, well done stock images of industrial farming, but this is what farms more often look like. Farm workers must wear protection when they're spraying pesticides. We have these giant farm equipment that are putting inputs that are fossil fuel based. Farm workers, I forgot to mention this. The farmers, there's Also consolidation with who owns farmland. It's often white people. I believe it's like 98% of farmland is owned by people who are white, and 78% of workers are people of color. So there's consolidation in that aspect. And so that picture there, you can't exactly tell, but those are likely migrant workers. And then animals are living in small spaces, getting antibiotics or foods that they wouldn't normally eat. They don't have access to the outside world. And so that is the type of farming that is kind of dominating our larger food system these days. And with that fossil fuel-based focus, there's a lot of emissions within the agricultural system. In the United States, the EPA estimates about 11% from grassland soils, energy use, enteric fermentation, which is cow burps and flatulence, manure management, and cropland soils. But if we look at the statistics a little differently, this is the global food system. Food emissions are actually much higher. I don't have a pointer, but you can see here that this includes livestock and fisheries and land use change. Land use change, I don't know the stats right off the top of my head. There's 18% of land use has changed. And with that, the stats that I'm forgetting are, and they're not even in my notes, is the amount of deforestation that has happened. And deforestation is a huge driver. I did not include the carbon cycle. I kind of wish I would, because land use, agriculture is driving land use change. And with that land use change has deforestation has happened. And when we lose trees, we're losing soil from the carbon, we're losing soil from the trees, and we're losing an important aspect of sequestration, because trees are able to take a lot of carbon out of the atmosphere and help put it back into the soil. And let me just quickly make sure that I'm telling you everything I want to tell you about this. This is my first presentation on food. I've given so many presentations on environmental stewardship and health. Thank you, Beth Shank, for supporting me with that all these years. This is my first on this. So thank you, Montana Health Professionals, for a healthy environment, for inviting me to do this. But I don't know all my stats as well as I would if it wasn't my first time. Thanks. All right. I did tell you everything on that slide. Cool. All right. So we've already heard about biodiversity loss. Agriculture is also a very large driver of biodiversity loss, and it's threatened about 80, it's estimated to contribute to about 86% of biodiversity loss. You can see here that 75% of terrestrial or earth ecosystems and 66% of marine ecosystems have been severely altered by human activity. We're impacting our pollinator systems. They're declining also. We've lost 85% of wetlands, which serve as a vital carbon sink. My colleague Allie Kane was telling me that beavers can help with that, and I thought it was important to mention here since we saw pictures of beavers earlier today. And 47% of all natural ecosystems have been cleared away. If you want to know more about, the species which we're at risk of losing here in Montana, you can visit the Montana Wildlife Federation. And also in talking with my colleague, she is wearing a sage grouse scarf today, which is one of our species which we're at risk of losing here in Montana. All right, so the story is the same, that everyone sort of said, how agriculture contributes to climate change through greenhouse gas emissions, and climate impacts agriculture. It's this loop. And so looking here, there's temperature and precipitation extremes like flooding can cause increased pathogen load. Climate change can alter weed, insect, and fungal populations and increase pesticide use. Rising carbon dioxide can directly influence nutritional content of food. Warmer temperatures can result in greater food spoilage. Extreme climate events can disrupt food distribution, and then so many more things: reduce crop yields, increase crop stress, decrease soil, etc. It can also really impact rural livelihoods, and this has negative externalities. Not only will agriculture be impacted, but the communities within which agriculture sits will be impacted when the money disappears, or we heard about the impact on the mental health of farmers, or if people have to move and migrate because they're not able to make a living doing agriculture anymore, then the example given in the economic impact of climate change on Montana, they say, you know, what happens when bus routes are discontinued and schools are consolidated and the fabric of our rural communities starts to unravel a little bit. Really fantastic podcast called Reframing Rural that focuses on agricultural and many other aspects of rural communities. And you can read that entire economic impact report, and it was from Farm Connect Montana had a company create this for them. And I forgot to mention that it's estimated to be about 20% to impact agriculture. It's a 20% economic loss expected. And you know, the same things that we've heard earlier today, I didn't really focus on them, but you know, Montana farmers will be experiencing hotter, drier weather, cold, all the things that we've drought, they'll impact farmers as well. So what do we do about this? The USDA's focal areas for reducing agricultural emission and focus on soil health, nitrogen management, livestock partnership, grazing and pasture, these other things, wetland, I don't know why that's, I think it's not meant to be crossed out, that bottom thing there. It's I think it's just a line in my, it extended past it. The good news is that the USDA is focused on this, and they have programs that are aimed at providing financial support and knowledge support for implementing these. So the NRCS program, Environmental Quality Improvement Program, which my farm is finishing up of for your grant with. The IRA funding is technically supposed to put more money into these programs. I hope that happens. And this is a really great start, but it's not the whole story of the way we can change agriculture. So agroecology is one method. It's like a thought. Here it says, based on a set of principles and elements, is a transformative pathway towards sustainable food systems. And here I am going to look at my notes. When I looked up the definition of agroecology to give you all a definition, I found a document with 9 pages worth of definitions, different definitions on agroecology. So I'm going to read my notes so that I don't mix it up. Agroecological farming practices aim to promote sustainable and environmentally friendly approaches to agriculture. The practices include mitigating climate change by reducing emissions, recycling resources, and prioritizing local supply chains. It works with wildlife to manage the impact of farming on wildlife and utilize nature for tasks like pollination and pest control. It enhances food security by improving availability, access, stability, and utilization of food, and promotes crop diversity. It's really rooted in just social justice and optimizing the interactions of plants, animals, and humans in the environment system. Climate smart agriculture shares some of these values also. It's another big management focus. You can see soil management, crop productivity, water management, et cetera. The thing to note about this is that it does not include the social justice or the interactions as much as agroecological methods, which the agroecological methods, we just heard about regenerative agriculture. You saw that on my slide. That's one of under the umbrella of agroecology. Climate smart methods, though, these provide solutions for large scale farms. It provides a framework on the scale that they already operate. And so for me, I see it as a great way to help farms transition towards a more agroecological approach, even if it doesn't focus on everything that agroecology does. So what does this mean for healthcare? You know, I work within the healthcare realm with food procurement within my hospital. And I just want to point to healthy food and healthcare food purchasing standards. There's 67 different certifications and label claims over these different categories. So environmental sustainability, local economies, animal welfare, valued workforce, community health, and nutrition. And they can help guide us when we're purchasing food that those labels basically tell us that we're purchasing food that's doing something nice for the environment or community health in these categories. And you can scan the QR code for the whole list of certifications. I'll talk more about my work at the hospital in the discussion period, but I just want to leave you with the idea, with these final thoughts. You know, food is medicine. I didn't spend a whole lot of time talking about how alive soil is, but my quote here, in traditional agriculture, the soil is the mother. She's the mother who gives, to whom you must give back. That's a quote from Vandana Shiva. And you know, the way food produced matters. Agricultural practices chosen by farmers can either contribute to or help reduce carbon emissions and the health of people. And then with that, I'll pass it along to Lindsay.
Thank you, Sarah. Well, I'm really excited to continue the conversation today, talking about how eating links us to planetary health. So food forms this inextricable link with the planet, and global food systems must operate both within planetary boundaries and within health boundaries for people. And so the food system is what links us in that way, and we need to operate within both of those boundaries. It's blinking. Do we know what that means? There we go. Okay. So a sustainable and healthy diet, the Food and Agriculture Organization of the United Nations and the World Health Organization give us a definition that a nutritious diet that promotes long-term human health, has a low environmental impact, is affordable, and is adaptable to local contexts and cultures, is a sustainable and healthy diet. And our Indigenous people have given us a nourishment model, which was just published last year. And we're going to talk a lot today about the planetary health diet. And I just want to acknowledge that that's often touted as one of the first of its kind, the Eat Lancets Commission's planetary health diet. However, it's important that we learn and listen to Indigenous peoples who steward much of the world's biodiversity through land and water conservation. And Indigenous knowledge systems are place-based, they're intergenerational, they're intuitive, and those knowledge systems have really been excluded from scientific inquiry for a long time. And that aligns with, really parallels with settler-imposed borders on Turtle Island, which has said that Indigenous knowledge creation and ways of knowing just are not legitimate. So I think that there are a lot of resources out there and Indigenous people speaking and sharing their worldview, and that it's something that we can listen to. So while for colonized belief systems, nutrition is physical. It's what happens to our bodies once we eat food. We can see from this Indigenous nourishment model that nourishment is really more comprehensive, and that American Indian and Alaska Native people better capture some cultural nuances, incorporating concepts like being a good relative to the land. And this is the first model I've seen in the scientific literature that really talks about this. And Tara Maudry, who published this, just got her PhD a few months ago from Johns Hopkins, and she's going to be teaching in Michigan. She got a tenure track position there, and she's really working with a lot of amazing people on this work. And I just want to point out that this nourishment model shows that there are spiritual responsibilities to a place, and that's a matter of like living in a good way. And I wanted to read a few quotes that can kind of ground us in this worldview. So many American Indian and Alaska Native communities hold sacred responsibilities to engage with aspects of their food system with reciprocity and to ensure the well-being and continuity of the food system, not just for humans, but also for their more than human relatives, plants and animals. I feel like in many of the other circles I'm a part of, we're still kind of trying to convince people of these connections, but it's inherent to ways of knowing with the Indigenous worldview. Second, land is an animate being. a relative, a food provider, and a teacher of law and governance to whom we are accountable. So I just want to point out, does this? Yeah. So land is part of the physical domain of nourishment. Community food practices connect people in relational ways. The original instructions are tied to creation stories, and it's what gives instructions on what that good way of living is. And they're also an emotional domain. So whereas nutrition in the world where I teach at the university is primarily physical, sometimes we will acknowledge like emotional aspects, but nourishment in this indigenous nourishment model is all of these things, or it's incomplete. So I wanted to lead off with this to give sort of a values-based food system model that you can be aware of. We're going to talk quite a bit about the Eat Lancet diet today. So the Eat Lancet Commission developed a planetary health diet whose goal was to meet the UN Sustainable Development Goals and the Paris Climate Agreement. And the diet has 3 domains. So it increases meat-free protein consumption or reduces meat consumption. It asks for more meal planning to minimize food waste, which has its own carbon emissions cost. And it focuses on bioregional sourcing, focus on local foods and seasonal foods. Who, by raise of hands, feels like they're somewhat familiar with the Eat Lancet diet? It's something they've heard about before. Okay, good, like maybe 40%. That's awesome. And so here's a plate version of it. So it's half fruits and vegetables, whole grains. It includes dairy, animal proteins, plant source proteins. So that's nuts and legumes, and very little of other things. So some of the pros of this dietary approach are that it's meant to be flexible and a starting point rather than exclusionary. So it's not vegan, it's not vegetarian, it's not only organic. It's meant to give people a flexible guideline that can try to meet people where they're at. It's also omnivorous, which is how most of the world eats. And some cons are, or critiques are, that it really focuses on the global north, meaning both the northern hemisphere and primarily white high-income countries' diets, and that meal planning and cooking are quite time and resource intensive. Especially time intensive is one of the great foci of especially limited resource folks in America have time poverty, right? And so asking for a lot of meal planning is quite strenuous. Oh, okay. So here is a daily diet look at what kind of changes we would need to see from a general American diet to meet the Eat Lancet diet. So it's high in caloric value from carbohydrate, with whole grains and potatoes or cassava, tubers, and starchy veg. It includes some dairy. Protein sources are varied, but it's often called like plant forward or plant-based rather than vegan or vegetarian. And fats are coming from what we would consider like healthy sources, so low in saturated fats and higher in our unsaturated fatty acids, which are better for heart health and cardiovascular health. It's low in added sugars as well, only 120 calories a day in added sugar, which is about half of what the dietary guidelines for Americans recommends. It also focuses on breastfeeding as a big source of nutrition, and that aligns with 3 of the Sustainable Development Goals from the UN as well, including reduced gender inequalities, zero hunger, and no poverty. Notable nutrients. So there is some concern that the Eat Lancet diet recommendations would not be adequate for every population. And that includes the red meat recommendations may not be totally adequate for children, menstruating people, and older adults because of valuable nutrients like zinc, vitamin B12, iron, and calcium. Vitamin D is also generally understood to not be met without fortified foods. And lots of our plant milks aren't fortified. I don't quite know a lot about that. It must be like a formulation thing. But almost all our dairy in the US is fortified with vitamin D, meaning added in addition. It's not something that's naturally occurring in those foods. And iodine and calcium are also nutrients of concern that are provided by dairy foods. So that's one of the reasons that those are included despite sort of their environmental impact. So next we're going to look at, in a week, what would this diet look like? So one could eat eggs for 1 dinner and 5 breakfasts, 7 eggs a week. I guess that would be 1 egg at each of those times. You get 2 eggs for dinner. So most people eat a 2-egg meal, right? So this is a little bit less than what you might be looking for normally. 1 red meat meal of 5 ounces or 1/3 of pound. So you're looking at like a deck of cards serving of meat per week. Poultry and pork, 10 ounces. So maybe 1 dinner and 2 lunches. And seafood or fish, 10 ounces. So 1 dinner and 2 lunches. And you can see some other foods there. But the foods in red are looking at how are we getting our protein is probably the biggest change for most Americans. And again, this is touted or is supposed to be like a gentle guide and something adaptable, a starting point. Really, in summary, about half of your daily meals are vegetarian, which works out about that 1 portion of red meat per week. And this is quite based on emissions. So in adopting the Eat Lancet or the planetary health diet, you could cut your carbon footprint by up to 2/3 as an individual. So you can imagine on a population-wide level the type of impact that this could have. So how would one go about starting to implement this diet? Well, we have some wonderful resources. I'm very partial to Abundant Montana. I used to be co-director at Arrow, which is now known as Abundant Montana, and really love this resource. There's a local food guide. There's also a website where you can find food and farms. You can find farmers market, community-supported agriculture, which is a shared risk model where consumers buy in to a farm and receive weekly shares from that farm. Farm to hospital, so any type of institution, food bank, farm to table, you can find those types of relationships in the Abundant Montana map, and also access to community gardens. Local sourcing in Montana, especially important, hunting, fishing, gathering, right? These are excellent ways to also be getting food as we're doing it responsibly. And another online resource that Bonnie pointed me to is buylocalfoodmontana.com. So these are ways that you can start connecting, getting seasonal availability, diversifying your diet and trying some new things, and just exploring variety. So you notice in the planetary health diet, there's like 3 servings of seafood per week. And in general, the dietary guidelines for Americans recommend more seafood or fish intake than what Americans typically get for the omega-3 content, which is a heart-healthy fatty acid. There are some resources. So how do we do this sustainably? Eating small fish might offer benefits for longevity. Bigger fish eat other fish and have a bigger environmental impact. So in general, smaller fish, who's heard that aquaculture is bad? Fish farming. Okay, there's a really nuanced message about this, and I actually got to learn a lot more by preparing for this presentation. So the Monterey Bay Aquarium publishes a fish guide, and you can see part of it here. and it's called the Seafood Watch. Farm mussels are where it's at. These are going to be your most sustainable choice. There's a ton of nuance in aquaculture that I invite you to take a look at. Wild caught is not always the best option, and it can totally depend on where those are because wild sources. So there's estimates that between 33 and 85% of worldwide marine resources are overexploited and declining. So that's related to overfishing. It's also related to climate change, and the impacts of aquaculture can be really good on ecosystems, and it can also degrade ecosystems as well. So what we're essentially looking at here is a lot of our marine food sources are being fished and harvested at a rate faster than what those species can reproduce. And this is in systems thinking what we call the tragedy of the commons. It's a shared global resource, it's a wild resource, and it's extremely difficult to manage because everyone's, when something is scarce, is going to take what they can get rather than having a shared conservation mindset. The tragedy of the commons. So this impacts food scarcity and also has severe economic impacts. So what we can do as individuals, and then we're going to really move into talking about more policy systems and environmental change beyond this slide, is that the best choices might be farmed abalone, king crab from Alaska, farmed oysters and mussels, swordfish from U.S. buoy gear, harpoon, pole, and tine. So how it's caught matters and where it's from. Alternatives, if you can't get the best, trout is most recommended farmed from the U.S., or I would say maybe caught from the Yellowstone if you're into that. Tuna, troll, and pole and line caught. Whereas tuna that is canned, you can look for specific labels, or yellowfin or ahi from the US, from the Atlantic or Pacific Free School. So this resource is so cool. You can go and you can click into each one and learn why the recommendations are what they are. And they have a sushi guide as well, which when I looked at was like, okay, I don't know any sushi place in Montana that is serving any of the species that are on this list. So I might be sort of thinking my like single girl dinner night choice when my partner's gone. So let's look at dietary guidelines. There are really few policy mechanisms we have to help people make dietary behavior changes, but the dietary guidelines are sort of generally a weak tool, but they're sort of what we've got. And in 20 to 25, so these are updated every 5 years per law in the United States, the scientific community recommended sustainability to be included again in the dietary guidelines, but it was not formally defined or actually addressed in the guidelines. In this year's dietary guidelines, we did finally see that meat and beans were no longer poised as an alternative protein, but one of the primary protein groups. So while we're still not saying we should eat any less meat in our US dietary guidelines, we are saying that there are legitimate plant-based sources. So the recommendation remains 26 ounces per week per person, and that's about twice the mean recommended intake from the Planetary Health Diet. There are also some recommendations for systems level changes and health equity, meaning that whatever changes and recommendations we make have to be reasonable for all people. If we're leaving some people behind, we're not achieving our goals. Sustainability, while not prominent in the US dietary guidelines, and we have a really fabulous student who actually interviewed people from the Dietary Guidelines Commission this year, and she's going to be working on publishing a paper and talking about her findings. Essentially, she found that the scientific committee made wonderful recommendations, and then the scientific committee report has undefined influence then from USDA and Health and Human Services and Congress. So ultimately Congress and Secretary former Secretary Vilsack are the ones who said, despite the evidence saying that our dietary guidelines should include sustainability, we say no because lobbyists and our constituents told us to say no. Obviously, this had to have a huge impact on many farmers, including beef farmers in Montana, if we were telling people to eat half the amount of meat than we're currently telling them to eat. So that's sort of how those things happen. However, the Nordic nutrition guidelines, which I think there's quite a bit of crossover between the Eat Lancet Commission and the Nordic nutrition recommenders. In 2023, they were saying have a diet rich in plants, consume less meat, more fish and nuts, eat more legumes, which are beans, and limit alcohol and processed foods. We're taking some students to Portugal in May, so we've been looking into those dietary guidelines, and we found that they have respect for seasonality as one of their recommendations. It is a traditional Mediterranean diet, and they recommend those cooking techniques. It includes a lot of soups and stews, which are actually like a really easy way to eat lots of veg. It's low impact, it's delicious, it goes a long way, it's economical. And they emphasize the cultural importance of meals, like sitting down together and eating regularly, which when I was in dietetics practice, essentially that was more than half my work, is saying, don't not eat all day and come home and eat the kitchen sink because it's 3 or 4 p.m. and you haven't eaten all day. So having a culture that values regular meal times is more essential than you might imagine in terms of long-term health impacts. The Netherlands also recommend less consumption of animal-based foods, more plant-based options, limiting fish intake to once per week, and choosing sustainably sourced fish. So already here you can see quite a bit of variety. While the Nordic nutrition guidelines are saying eat more fish, the Netherlands is saying, wait, this is a limited resource and you have to select your fish very carefully. So it's quite nuanced and pretty difficult to know exactly what to do. So how do we actually get people to change their behavior when it comes to food? This is a study that was done at a university, and they looked at individual level behavioral interventions, environmental level interventions, which included food promotion, the cost of food, people's time, and their resources, and then also food establishment level, and then policy level. And what they really found was that there's a ton of decisions, of things that go into our food decisions. And it's really at this environmental level where we can make the most change. So the price of foods, food promotion, eating norms are where they found that they had the most power or leverage to get people to make some different choices. So this is often called behavioral economics, or like making the healthy choice the easy choice. This would be like making the planetary diet the easy choice. So convenience matters, cost matters, availability matters. And Food and Planet is a really wonderful organization started by 4 dietitians who are really committing themselves to communications and education about planetary health. And they said they do an annual survey, and we're really fortunate that a student's been helping them with this survey this year. It's just like a ton of really cool learning. And cost is the number one. Confusion. Anyone here confused about what the recommendations might be? Yeah, it's confusing. So next, we're going to talk about how do you make decisions in this sort of confusing world. Cultural exclusion. If you don't see your culture represented in dietary recommendations, are you going to pay any attention to them? Are you going to think they're for you? Or are you going to think that this is a white tower putting out recommendations that don't impact you or relate to you at all? Yeah, so we have a problem with that in our dietary guidelines. They're like getting better, but it's still not, the planetary health diet, that's one of its biggest criticisms, is that it's not culturally responsive. And convenience. Unless you love food or are very health conscious, people are making the most convenient choices that taste the best, right? So those are our realities, and we need to find ways to meet people right where they are. So this is a model developed by Angie Tagto, who's another dietitian doing really great work in systems change and sustainable diets. And it's called the I plus PSC conceptual framework. You might recognize it as a logic model. And I stands for individual, and then PSC is for policy, systems, and environmental changes. So what this model does is in phase one, you ask a lot of questions and you do a lot of assessment to really try to define what's the current state of something. How does it impact social determinants of health? And then in phase two, you formulate solutions that are across this is called the spectrum of prevention. It starts with an individual, it goes to promoting community education and engagement, activating intermediaries. This is often called educating providers, formulating partnerships, aligning organizational policies, fostering physical settings that like walkability, for example, or things that help people to do the behaviors that you're asking them to do in physical spaces. And then finally, public policies. So, and then you evaluate the impacts and then you go back and you reassess. And so this is a model that can be used to help with policy systems and environmental change, making those healthy choices, the sustainable choices, the easier choices. And Food and Planet has done a wonderful job of taking some of these solutions and communicating them better, essentially. So encourage consumption of a wider variety of minimally processed grains, legumes, fruits, vegetables, nuts, and seeds. Promote sustainable protein sources such as swapping out beans for beef. Reduce levels of food waste within food service operations. So these would be examples of individual, so I have it in red here, or educating or making changes at the service provider level in like a food service organization, for example. Other suggestions: incorporate sustainable dietary framework that meets your client's needs while providing actionable guidance. So that would be individual level change, but also trying to educate providers on how to help patients on this wide level. Seek diverse colleagues to provide practices to include all people that you serve. So sort of a health equity focus that requires some multi-sector collaboration. And keep up with emerging high-tech and low-tech solutions to help translate what we know and where there are gaps. So try not to be biased towards high-tech always, but knowing that the Global South also has like some really amazing solutions that have been working for a long time. So in dietetics, we have standards of professional performance for sustainable, resilient, and healthy food and water systems. And what this means is that I think it was in 2013, we said that entry-level dietitians need to be competent in what we call sustainable, resilient, and healthy food and water systems. And they gave us a decision framework that has 4 domains. So nutrition and health, which is where we normally sit, that felt pretty good and competent. But they also put evaluation of environmental stewardship, social, cultural, and ethical capital, and economic vitality within the scope of practice for dietitians. And this was at the same time when the Dietary Guidelines Scientific Committee was saying that they wanted to do this for the dietary guidelines, and Congress told them no. So dietitians said, we're going to still take that step forward. Has anyone here heard of the producer partnership? So it's the only federally qualified, federally inspected nonprofit multi-species meat processing facility in the country, and it's in Livingston, where I live. And they take cull cows or primarily grass-fed mama cows that have lived on grass their whole life, primarily, that are no longer producing, and they process those and they put them in 1 pound ground meat packages, and they go to the Montana Food Bank Network, which serves like more than 100 food banks or food pantries throughout the state. And they also are building farm to school relationships, those kinds of things. So I think I'm going to have to speed up. I do really just have like a few more slides. So we'll move through this example and then we'll go to our discussion. So One way that you could use this example with producer partnership is that you could say, well, cows are fed on grass, and that's really good for our nutrition. They're going to have proportionally higher omega-3 composition. While it's not a significant amount of omega-3s, it's going to be proportionally higher than what we could get from feedlot. We also know environmentally that grass-based meat is a lot, feedlot meat is like 75% of all agricultural emissions. So grass-based meat is going to be a way more sustainable option. However, where we often miss out on this type of agriculture is that's not economically available to most people. So producer partnership kind of cuts across that and is also putting it in institutions that feed, like school meals feed kids like 2 meals a day, right? Food pantries are feeding a lot of meals a day. So I really encourage us to kind of think beyond the individual interventions too, and what we can do at the policy and systems level. This is just a cool slide for you to look at later. Food and Planet took this model and made it prettier and really like to communicate well. And so these are ways that you can say, is my food decision offering a co-benefit between like producer partnership, planetary health and nutrition, and economic? Or is it like maybe a private farmer selling grass-based beef, a trade-off where there's a co-benefit between planetary health and nutrition, but a trade-off because it's not economically available to everyone? Because not every decision is going to be clearly, this is great, this is bad. So these 4 domains offer us a decision-making framework, again, to look at co-benefits or trade-offs. And this is a framework we teach to students. Last slide. There are lots of people, healthcare providers, dietitians in Australia, Canada, Italy, the USA, Europe, who are working on this across the world. So this is our hope slide. Lots of people are doing it. The International Confederation of Dietetics Association has a meeting every year. I'm really hoping to take students next year, the year after, and they're constantly publishing on these things. And there is a sustainability toolkit on their website that's super cool that I really recommend. They're offering a lot of education. So with that, it's time for questions. So sorry we took so much time on this.
So I realize we don't have a whole lot of time, but just want to ask quickly some real world examples you might give for the use of some of the models for the future dietary guidelines.
Do you want to please talk about St. Pat's?
Sure. Let me give the quick down and dirty on how healthcare institutions and healthcare providers can kind of support better farming practices. You've got a lot of it, your personal choices make a big difference. Within healthcare, we can use our healthcare dollars to purchase more sustainable local food to increase the resilience of our food systems. The Healthcare Without Harm Practice Green Health list of certifications is a great guide. If your hospital or healthcare, wherever you're working, if they're not doing that work, you can advocate within it for them to do that. Oh my gosh, what else do I want to talk about? Oh, yep, we have on-site CSA delivery. We have the prescription produce program that we use. If you don't have, if you're in a place where you have the prescription produce, you can refer patients to it. If you don't have one, you can advocate for it. You can reach out to Bonnie at Farm Connect Montana and be like, do we have one? Where would I find more information? You can look at their website. Advocacy, as we learned, is a great platform. For those of you that are working directly with patients in healthcare settings, specifically nurses, I'm a nurse by background, you can work with patients to make sure they're ordering food that tastes good to them so that their food is food that they want to eat. Food waste is a huge problem. We waste over 40% of food that's produced, which is a lot of calories and a lot of carbon emissions out the window and money. Reducing food waste personally and helping professionally. If composting within your healthcare facilities is a great way to reduce food waste, making sure you're donating working with your food service staff to focus on plant-forward menus, making sure they're cooking right amounts of food, so they're looking at what they're producing, what people are eating. Oh gosh, so many more things, but I feel like I want to give Lindsay a chance to say a few more words.
I'd like to hear your questions, maybe.
Mine, or do you want to open it?
Or-
Are there?
We aren't gonna have much time, we're about out of time, so maybe we can take one or two questions from the floor.
And or examples that people have
Yeah.
from where you are? Maybe not.
Gave you so much to think about at the end of the day.
Do you want to wrap up with just some real world examples of what you're?
I think maybe just some resources.
Okay.
Okay, so One Earth, these are supposed to have linked like articles that must not have transferred from Canva. But One Earth has like a sample planetary health diet that you can try out. So go check that out. The Eat Lancet Commission has a brief for healthcare professionals. It's like 2 pages. Check it out. And there's a nutrition and health professionals toolkit on seafood too, and making decisions on that. Finally, there's an organization called A Growing Culture, which really uplifts the stories and voices of landless peasant farmers from across the world. They don't operate a lot in the US, but it's just a really very cool example of like low tech, highly sustainable models that are primarily feeding people first, and they're really focused on the power dynamics in the food system rather than necessarily soil first or water first. I think we get really caught up in the US thinking about taking care of the environment, maybe at the cost of taking care of people sometimes. And so I just like to point out that changing the power structures and thinking on that social justice piece is a really inspiring topic that A Growing Culture does a really good job communicating. So I encourage you to check them out.
Thanks for your interest in Montana Health Professionals for a Healthy Climate's annual conference. If you'd like to be kept up to date on monthly actions for climate and health in Montana, you can go to montanahphc.org/newsletters to sign up for our monthly newsletter or click the link in the description below. And don't forget to subscribe.